My name is Professor Sandip Hindocha. I'm a consultant plastic surgeon and also the clinical director of the Department of Plastic Surgery at Bedford Hospital. I work as a consultant around the country from London up to Manchester. So I always had an interest in doing something with science when I was in school, and I had a avid interest in chemistry and maths actually, and that led me into a natural progression into medical school, which I found very rewarding, and got into it pretty much from day one. From about year three of medical school, I started to explore different specialties, and I realized that I wanted to become a surgeon first, and I wanted to become a surgeon that would actually change people's lives. Maybe not necessarily save lives, but change people's lives. And I wanted to do some form of rehabilitative surgery. So I had three options: either orthopedic surgery, neurosurgery, or plastic surgery. And I found that plastic surgery, you could actually operate on anywhere on the body, and it's not really fixed in terms of what we do. There's a million ways to do the same thing in plastic surgery, and it's challenging for your mindset. And so I became a lot more interested in the techniques of plastic surgery, which, you know, plastic comes from a Greek term to sculpt or to mold, and that artistic element comes into it. So I, from very early on in my career, I decided to become a plastic surgeon. I'd say everything, you know, no day is the same, no patient is the same, and no operation is the same. And so, every day is like opening a present. It's like Christmas every day. You don't know what you're going to get, but every day at the end, there's always something positive to take home. I think feedback from patients is that they find my approach very open and caring. And only yesterday, a patient said to me that I'm very easy to talk to, and they feel like they can just ask me anything about the procedure without hesitation, and without any concerns about what I will think about that question. And they, all of my patients know that they can always ask me anything in relation to their surgical procedure, and I will do my absolute best to make things to their satisfaction, so they're happy. In terms of my patients, I value them a lot in that I see that I don't think I've ever had a patient that hasn't kind of taken on board any surgical advice that I've given them. And I know that that can happen, but to date, that's not been a case for me, and I'm very grateful for all the patients that come and see me. I always say to everyone in my department that work is fun. So work equals fun. So that means that you should, be happy at work, and be happy to learn every day, and be happy to be actually making a difference to people's lives when they come and see us and then when they leave us.